Well, there are huge challenges. It's miles away from doing a nice, simple, controlled experiment like you would do for a drug, for a new medicine, for example, where you give one group of people the new medicine and another group you give a placebo or whatever, and you follow them through, and it's very simple, and that's what's called a controlled trial. But you can't do that with people in communities. You can't deliver an intervention to one group and not to another and make them do what you want.
These are what we in public health research refer to as complex interventions, right? So you're intervening in neighbourhoods where there's an awful lot of things happening, a lot of other initiatives going on. The context in these neighbourhoods, the environment, the history of the social development, the industry, the jobs, everything is so different. This big local initiative has got 150 neighbourhoods. So in one way, you've got 150 different interventions going on, all trying to achieve the same focus. They're complex, so you can't control. It's not like an intervention in public health where you do something to try and get people to eat different food, and you can have a group where you intervene and you can control the other group so it doesn't happen there. It's not like that. So the challenge is coming up with a design for the evaluation which people outside of public health and practitioners will accept is robust enough, that the evidence is good enough quality. So you can't do what's referred to as a randomized control trial, you know. So we're really evaluating what some people call a natural policy experiment, and we can't have any controls. So it's really about that. It's about coming up with a design that's good enough, where you can make some really quite strong inferences about causal pathways, that doing A, you can be pretty sure that that did lead to B, to that impact. But you can never be as sure as you might be in a simple randomized control trial. So that's probably the biggest challenge.